Hallux valgus deformity is commonly known as bunion deformity, where the patient experiences a bump on the inner side of the foot, which is at the base of the big toe. Hi, my name is Dr. Sunil Ramavat. I'm an orthopedic surgeon. My special interest is foot and ankle surgery, and especially minimally invasive foot and ankle surgery. My practice is in Sydney West. Today I'm going to talk about hallux valgus, which is the bunion, and also some lesser toe deformities. Hallux valgus deformity is commonly known as bunion deformity, where the patient experiences a bump on the inner side of the foot, which is at the base of the big toe. Some patients also experience some deformities in the lesser toe, such as hammer toe deformity or a claw toe deformity, which is basically a deformity of the toes when they curl up and they don't get straightened. The reason for hallux valgus or bunion deformity is multifactorial. They can be hereditary, or can be due to the faulty use of shoes, or sometimes there is no real cause identified. The reason to seek a medical attention by these patients are when they start to find that the bunion is painful, especially when they feel that the bump rubs against the shoe and they can't find shoes, or the wearing shoes is too painful. Usually they try some non-operative management first, which includes a spacer between the big toes. They use toe sleeves for the lesser toe deformities, and if the non-operative management fails, then the surgical management has advantage. Conventionally, the surgery for hallux valgus was done with open technique, where about 10 to 15 centimeters of incision was made from the joint in the big toe to all the way to the joint in the midfoot, and that was quite a large incision. However, it had a great success. Lately, for the past 5 years or so, I have been performing the hallux valgus surgery using minimally invasive technique. In the minimally invasive surgery, I perform 6 small incisions on the inner side of the foot and 1 small incision on the in between the big toe and the second toe. By doing this, we achieve excellent correction of the deformity, and the deformity is corrected by performing a medical procedure called osteotomy, which is using a burr and making a cut in the bone, moving the bone across and straightening the deformity. To stabilize the osteotomy or the cut in the bone, I typically use 2 screws in the bone called first metatarsal, and then similar procedure is done in the bone called proximal phalanx for the residual deformity in the toe, and there's 1 screw in the proximal phalanx as well. Some patients also require some soft tissue release, which is performed between the big toe and the second toe. For lesser toe deformities, similarly, I use small cuts to correct the hammer toe deformity or the claw toe deformity. By making a small cut where the hammer toe apex is, I use a burr to shave off the deformity, and then I straighten the toe and pass a screw in there. Typically, these patients, because the soft tissue dissection is less and small cuts being made, they experience less pain postoperatively in comparison to the open cut surgery. At 2 weeks' time, when I see the patients, they have much less swelling, much less requirement of analgesia, and they are much happier. At 6 weeks' time, most of them, they are, from the day 1 after surgery, they all start to weight bear with a special shoe. At 6 weeks' time, they come out of the special shoe which is given at the time of surgery, and they start to use normal shoes. I'm very happy with my practice. For the past 6 years, I have had great success in this minimally invasive technique for the forefoot surgery, including bunion surgery, bunionette surgery, and as well as lesser toe surgeries.